and jointly with the Marshall School of Business, it's a pleasure to welcome everybody here. And it's wonderful also to think about these collaborations across schools and the ways in which we can bring kind of ideas together and people together that we can talk with. So having said that, I'm absolutely thrilled to introduce somebody I've known for a very long time, perhaps longer than I want to admit, that I've known for a very long time. And the thing about Joel Lamstein, he's somebody that I admire, he's somebody that I respect. He's also someone I really like, right, in terms of just who he is and who he is as a person and the things that he does. Joel Lamstein is president and co-founder of John Snow Inc., JSI. And let me just say a few things about JSI. JSI works in 107 countries and all 50 states of the United States. JSI collaborates with government agencies, the private sector, local nonprofits, civil society organizations, but all with an eye towards identifying solutions that are going to be most effective to folks at the community level. And that's, I think, one of the things that really stands out. And that, I think, is very much of the ethos of Joel and of JSI in terms of how they work and what it is that they do. JSI, under Joel's leadership, has grown also to include the JSI Research and Training Institute. But I just want to say something else, which is that Joel not only runs JSI, the JSI Research and Training Institute, he's the president of World Education, Inc., which is a nonprofit that's dedicated to improving the lives of the poor through education around the world. He is also faculty at the Harvard School of Public Health. He's also faculty connected to a range of different universities. He's also on the boards of numerous nonprofits. And he says he does all of that for fun and in his downtime. Right? So there we know why it is that you achieve the things that you achieve. I think that his focus on bringing different people together and opening conversation is one of the things that we really need to appreciate about what Joel offers and about the kinds of conversations that we have. And so with that, Joel, the floor is yours, and thank you so much for coming.
Great.
Join me in welcoming.
Thank you. Thank you, Sophia. So the last time I was introduced, it was by one of the funding agencies who introduced me as the oldest boy wonder he ever met. So we have to put this a little bit in perspective. So just by a show of hands, how many of you are business school students? And the rest public health? And the rest something else? Okay. So what I'd like to do is sort of give you a little rundown of JSI, this organization that I run, and then sort of answer your questions. So we could talk about the management of this, why you do it, how it runs. We can talk about the issues in public health and why we focus on that. So some of it depends on your feedback and what you want to think about it. Let's make it totally informal. I teach a little bit, as Sophia said, at the Public Health School at Harvard, just an adjunct, so I'm not really, so you have to talk slowly. I'm not really a professor. It's hard for me to understand. And I know most of you came for the food, so my ego is fine. And I have to do this from this odd angle here. The technology at USC is not as good as some places. Oh, I'm just kidding. So JSI was formed. I formed it over 40 years ago. I formed it with an MD who had done some of the original work in Bangladesh, East Pakistan at the time, in cholera research and helped invent oral rehydration therapy. So my background was entirely different. I went undergraduate to the University of Michigan. I was a math and physics major. The worst they ever graduated. I think they lost their accreditation right after I graduated. And then I went back to management school. So I went to MIT Sloan. So I had a management background. And when I came to public health, it was because I got involved with some professors who were looking at applying technology to public sector issues, in particular public health and in particular family planning, because we were building some fairly sophisticated models, data models, strategic planning models. And I just happened to be a graduate student, and they offered me a job in the summertime, and it was near the tennis courts, so I figured that's what I'll do. And that led to forming predecessor organization to JSI, and then JSI itself. So, and my background, meaning that coming from outside the field, I thought about it a little bit differently. And when I looked at things, it was very clear to me that there are a lot of people doing a lot of good research here, other places, other academic institutions. There are a lot of people who are doing a lot of very good policy. But when you looked out in the field, it never got there, because no one wanted to do the implementation. No one wanted to roll up their sleeves, dig latrines, train community health workers, worry about supply chain, all the things that really make things work on the operational level. First of all, you don't get tenure by digging latrines. Is that right? Yeah, you didn't get tenure. No, okay. Yeah, and so these were really on-the-ground issues. And it seemed really interesting if you could form a group of people who had the intelligence to do the research and had the intelligence to do the policy, but were more activist-oriented. They want to roll up their sleeves and make a systemic change. And so that's how JSI was formed, just to think about working with universities, working with policy institutes, but translating that into on-the-ground knowledge. And so that's how we thought about the world, and that's essentially how we still are doing it. We do a lot more research and a lot more policy because we've been around 40 years, but if you ask people really what they want to do, they want to roll up their sleeves and they want to really work with a community institute, they want to work with an NGO overseas to change how they're thinking about things. And we started in Boston, and Boston is a really good place to start this. What do you think? It's not the weather. It's not the New England Patriots. What do you think? What does New England have a lot of? Hospitals, universities. So within Boston, which is 700,000 people, Boston and Cambridge, maybe 800,000 people, there are 120,000 students. And so we were very lucky to start in a place where there's young, enthusiastic, passionate people. Not old and cynical like me, but really ready, wanting to change things. We could do it here, we could do it at any university town, but it was very useful to be in a place where you had people who were idealistic and passionate about women's health, about family planning, about maternal health, et cetera. So that's how we thought about it, and if you looked at JSI now, it still has a very big cohort of young people who we recruit from the universities, and not now just from not just from Boston-centric. We have 8 offices, as I'll show you, and we now have a California office, which was in San Francisco, but we couldn't afford it, so now it's in Berkeley. So let me see if we can go through this quickly. I don't want to dwell on this, but so these numbers will all change. So here's the staff demographics. I don't know where we have the 18-year-olds, but we must have some of them. It's sort of child labor. We like that very heavily. And you can see that there's a fairly young cohort. And that's in some sense deliberate, because we have people who are just so dedicated to these topical areas, and many of the ones who are probably in the 18 to 30 age group will stay for a while and then go back to graduate school here or some places like that. Let's see if I can keep going. Yep. I guess I'm missing one part of this. Okay. So as a public health organization, those of you in business school should now leave the room, because if you work in public health, you're going to make no money. You're going to be working really hard, but you'll have a great impact. So we mostly work with underserved populations, both here in the United States and overseas. And the other thing which is distinctive about this organization is that it's a very people-oriented organization. We can talk about, it's a very distinct culture. It's a very different culture than perhaps you're learning in business school. It's very flat, non-hierarchical, but it's primed to have people of passion who really want to make a difference. So if you think about it, you can make a difference yourself, but if you're in an organization, it can magnify that difference. And that's the kind of thing that this organization is primed to do. These numbers all change. Annual budget of $450 million, a little bit fallacious in the sense that a lot of that money comes in and goes out. So we run big supply chain activities where we buy antiretrovirals, particularly for Africa, particularly for HIV. And so that money sometimes comes in and out and inflates the overall annual budget, but the annual budget probably is closer to $200 million. You can imagine that these are the values that we have. Everyone has values. If you have any that you don't like, let me know. So here are some of the things that we've done. Mostly what we do is not technologic, but of course now everything is technologic. So we are actually flying drones around Africa to try to do some work on supply chain in areas that are quite difficult to reach. There's a HHS website and activity called hiv.gov. You can go online, you can find it. It's a reach out to the minority community about HIV in the United States. JSI runs this. I mean, you'll never see our name anyplace, but this is run by us, and it has all the things that I don't know about: Instagram, Twitter, all the things that you're probably doing while I'm speaking. And so this is a reach out, and we've been running this for about 10 years for HHS. We're doing a lot of, there's interesting issues of sex trafficking in Wisconsin. Is anyone here from Wisconsin? I had never knew, no, are you? No, okay. Never knew anything about sex trafficking in Wisconsin, but we actually got some work to work there. Anyone know who this is? That's the governor of Massachusetts. He is, just an aside, Massachusetts is like California, incredibly democratic state. He's a Republican governor, and he's the most popular governor in America. And he came to speak to us about opioid abuse and what the state itself is doing, because we're working a lot in it. We actually have an inside line to him. His brother works for us, so. Which actually turns out to be very dangerous, because people think, well, we're getting contracts because of his brother, which we don't, but. So we're doing some technology, some fun stuff in Kenya about contraceptives and using games and other kinds of things to reach out to young people. We've plotted roads. Again, supply chain is one of those things that is not very sexy, but is really the most important part. People don't come to clinics unless there is drugs. No matter how much you talk about prevention, they want to have those drugs. In many places, Tanzania not being the worst, it's a very difficult place. It's very difficult seasonally when the rains might come. And so how to plot this out, how to figure out how to get there optimally has been what we've done. Again, some contraceptive technology in a number of countries. This is a staff actually in Madagascar. I don't know why that's in there, except that they look happy, so we put them in. For many years, we wouldn't work in Iraq because we thought that the American involvement was a bit bad, and that therefore working on healthcare was, number one, dangerous, and number two, a little bit of a Band-Aid on what we thought was going on. But now that the war is essentially over, we've been asked to do work in a number of areas, and so the staff itself decided that it was a good time to do that. Again, we have a California office in Berkeley. We're doing a lot of work on healthcare reform in California. It's a progressive state. Those of you who know without being too political, the federal government is not going to do very much. Everything is at the state level now. The progressive elements are really at the state level, California being one of the leaders of that. We're doing a lot of value-based payment, changes in how you pay people. And so in New Hampshire, so we have an office in New Hampshire, opioid abuse is a tremendous problem. All rural areas have a tremendous problem. And so we're working with the state to figure out how to reach the population, eliminate the stigma. People won't are afraid to go to treatment, try to use some technology to get them to go to particular places. We actually had a campaign, sort of a PR campaign saying, don't worry, just go, you won't be reported, et cetera. So that normally outside of what we would normally do, but it's quite important now. And again, we're doing, we have a whole section that's doing work in healthy cities. It's run by a woman who tries to get me to eat kale every day. I hate it, but so there's a whole series of, this is the oral rehydration therapy. So we ran the first oral hydration therapy national project in 1985 in Egypt. And the interesting thing about this is we used every technique possible, because in the old days, what oral rehydration therapy is, if you have cholera or if you have diarrheal diseases, you use this to, especially with kids, to rehydrate them, because you normally don't die of the disease, you die of dehydration. And kids will drink a little bit of this salt and sugar solution, which is electrolytically balanced, to rehydrate you. But it was very difficult to do this because the doctors in the country make a lot of money selling antibiotics to people to cure the disease, which it really doesn't. So if you think about it, this is a really behavioral change project, because not only did we say the doctors aren't going to do it, we said the mothers are going to do it. So you can buy these little packets, put it in water, and rehydrate kids. So you can imagine what resistance there was from the medical community, which is very strong in Egypt. So we used everything, including designing that logo, using the most famous maternal figure in all of Egypt in advertisements. So it was really private sector, overlapping with public sector to try to make sure that we can get this message out to people. And that logo went from, of course, no one knowing it, to being the most popular and most recognized logo in all of Egypt, more than Coca-Cola even. So we were quite successful, and it was claimed to have saved over about a 10-year period, 250,000 children. So if you want to get into public health, that's what your outcome is, not just the bottom line. That is the impact that we have. Again, as I said, we deliver a lot of antiretrovirals across mostly Africa, mostly southern Africa. In any day, we are delivering about 2.5 million antiretrovirals, which means 2.5 million people are being kept alive. As you know, in some ways, HIV and AIDS is a chronic disease now. You could be kept alive by it, but you need these every day. So you need a very robust system. You can't, it's not like vitamins. If you didn't take them today, you could take them tomorrow. You have to take them every day. And so this is you can imagine this is a very difficult project given the countries that we're working in. Let's see what else we got here. So that's it. So let me give you sort of a rough estimate of what JSI is like. We have about 2,500 people working for us. We have, of those, 1,800 people who are working internationally. And of the 1,800 who work internationally, about 1,750 are from the country or the region that we work in. So the head of our Ethiopia program, where we have 400 people, are is Ethiopian. Ethiopian woman is running it. We have 399 Ethiopians and one Kenyan who snuck in. I don't know how they got in, but he's a Kenyan. In Zambia, we have 500 people working. 500 people are Zambian, 2 big projects run by 2 Zambian women. So for those of you who are public health students, the days that North Americans, Europeans would go to places like Africa, Asia, and show people what to do are over. And so you get fantastically good talent in those places, which gives you some sense, if you're in public health and you want to go overseas, it's going to be really different than when I started. We could talk about that if you're interested in that. This organization also is run, as I said, in a very different way. I kind of hate hierarchy, and I find that, especially with people of real passion, young people, that hierarchy constrains what you do. And so part of this organization is very flat. It has an organization chart, but no one knows it. I'll tell this story. About 5 years ago, we were always audited. We're a big federal provider, so we're audited all the time. And one of the auditors came in to me and said, "Can I see your organization chart?" And of course, it's there. I don't know what it is. No one, we know who relates to who, but we don't really have a chart that everyone looks at. So I ran off. There's a little program called Visio. I made up the organization chart. I showed it to him. He thanked me. About 2 days later, he said, "I lost that. Could you give it to me again?" Of course, I didn't save it. So I recreated it, gave it to him, and then he looked at it and found the first one, and he said, "Doesn't look like the second one." And so it was a very fluid organization. It moves very quickly. True story. So there is a organization. There's an organization, but my sense is in these kind of organizations, again, this is not Goldman Sachs. People are joining because they want to make an impact, not because they want to make a lot of money. And therefore, they're passionate about these causes. And therefore, what you can do for them, especially young people, is to give them opportunities to learn and to grow. And so the flat organization allows people to work on various different projects over the years and not be sort of focused on a narrow band of them. So, do you have a question?
More on, if you could give us an example of, in the U.S.,
Yeah.
whether it's in California or New Hampshire, wherever, of project that you did, and how did the flat thing work? How did you
Sure.
process work, the structure work?
So we have, as an example, we have a big project now to work on opioid abuse and HIV, the overlap between those. It's a national program. It's run out of, so we have 8 offices. It's run out of 6 of those 8 offices. So we have a project director and then people on these various places. And because there's not a very fixed hierarchy, we can put teams together. And I should tell you that we've been picked as one of the best places to work in Massachusetts, one of the best places to work in DC. Let me tell you why. So, and I've been interviewed about this, and the answer is we're very clear about what this culture is. So we say to people, if you have a big ego, don't show up. If you can't work in teams, don't show up. If you're not passionate about these causes, don't show up. If you can't really work productively and hard, don't show up. And if you don't have a sense of humor, don't show up. Because this is very hard work and it's not, as you know, overpaid. And so we're very selective about who we pick. So we've rejected, as you can imagine, you're sitting with a bunch of incredibly good academic talent. We've rejected a lot of those because they couldn't work in teams. They couldn't work with each other. It had to be about them, et cetera. And some of them, this is if you came to the offices, looks pretty laid back and people are enjoying themselves. They also will be there at 10 o'clock at night writing proposals, et cetera. So we're very careful about selecting people. So as I said, at least in my estimation, organizations are all about culture. There's not a right or a wrong, but I guess the fancy management word is alignment. So these people are aligned with the culture and picked to be aligned. So it's a self-fulfilling prophecy. And we're very careful about doing that. And that's worked very well because public health often has overlaps. So we need a sociologist, we need an IT person, we need a public health person, we need a management person, and we need to get them in a room together and they need to work together. So that's the kind of thing that we have. So about 700 people in the US, 8 offices. We have an office in Boston. The big offices are in Boston and DC. And we have an office in New Hampshire. We have an office in Rhode Island. We have an office in Atlanta. We have an office in Denver and an office in California now. So it's a broad spectrum of that. So and about 75% of what we do by dollar volume is international, funded by big international organizations like US government, USAID, Global Fund, which is a multilateral organization, the World Bank, the World WHO, those kinds of organizations. And about 25% is in the United States. And of those, probably many more projects are in the United States, but they're smaller projects. So internationally, we have a project for $40 million. In the US, we might have a project for $50,000. And so we have huge turnover of projects all the time. So that's how this works over time. And there are a lot of sort of important questions. Some of it is related to this administration, who is not really interested as much as we are in international development, who are worried about budgets and trying to cut the budget. I guess the president's budget this year looked for a 21% cut in international development. Last year, I think it was even worse. The Congress puts it back again. But that's the sort of difficulty that all these groups have, is trying to figure out how to do it. But let me ask you a couple of questions. So what's the GDP of the United States? You should, don't look it up in Google, because Google knows, but take a guess. What do you think it is? 50 trillion. Well, how much? Pretty close to 19 to 20 trillion. That's with what, 12 zeros? What's the US budget? It's going to be in deficit, but what's the US budget? You guys are going to vote, aren't you? What's the budget? Take a guess. It's in the trillions. I'll give you that hint.
2 trillion.
2 trillion. Do I hear higher? 3.3. I have higher.
5.
It's about 4.8. It's about 4.8, depending again on what deficit there is. So now we have a 19 to 20 trillion dollar GDP. We have about a $4.8 trillion budget, federal budget. How much is the foreign aid budget? Well, you got to multiply that out.
$500 million.
$500 million. Anyone else? It's about. Does that include the military budget? No, the military's got a lot more. So it's about 55 billion, right? Again, depending on the way you count it, what's included. I mean, some of that is the State Department, some of that is the Peace Corps, et cetera. So now you have 19 trillion, 4.8 trillion, 50 billion, of which how much is AID, which is the foreign aid branch? It's about 25 billion. And how much of that is health? About 9 billion. So 9 billion divided by 4.8 trillion, or 19 trillion, is how much? Very small percent. It becomes a political football all the time. We should bring that money here. Why do we have to do it overseas, et cetera? It would make no difference. It is such a minuscule portion of the US budget, but it just becomes a political football back and forth between people. So one group gets in and says we shouldn't do any of it. The other group gets in and says, no, we have to do more of it. But that's the environment which we work in. So it's very hard to understand on a day-to-day basis where the funding is going to come from. And the only other major funding are other countries which go through the same thing, or the big foundations. And the biggest foundation is what? Gates. And how much money do they have? What's their endowment? 40 billion. Okay, around 40 billion. And they give out $3 to $4 billion a year in healthcare. Mostly international, a little bit, they do education mostly in the US. So they're giving out 3 to 4 billion. US government is only giving out 9 billion. I mean, so they're almost half to a third of what the whole US government is by one foundation. And they're a very good foundation, but you might ask the question, who are they accountable to? Who is the foundation accountable to? Their board. And who are they accountable to? The corporation. Maybe. The answer is that while we love foundations, it's not clear who they're accountable to. So it's great that Gates is doing what they're doing, because it benefits us. They're funding a lot of our projects in Ethiopia, as it turns out. Terrific. And Bill Gates actually went there and surprisingly loved it. So we breathed a sigh of relief. When he went there, we were all very tense for a day, because if he doesn't like it, it's his money. You're gone. We happen to have a fantastically good Ethiopian woman who actually charmed him, and so we're fine. But in the U.S. government, and you can argue that it's good or bad, there's a process by which you write proposals, it's reviewed, et cetera. And again, when we lose a proposal, we think it's unfair, but it's pretty well understood how you do it. Gates Foundation? Who knows? I mean, they have a process now, but you have no recourse. If they don't say, I don't like you, you don't get the money. So it's a very difficult environment to be working in, because there's this uncertainty that goes along, and because it becomes a political football. So let me stop. Any questions? Yes. She's a setup. She was going to ask the first question. Yes.
How is JSI measuring impact, and have you looked at frameworks like social return on investment as one possible way?
So who's the public health students here? How easy is it to evaluate impact? Challenging. Why is it challenging?
Because it can be measured in a variety of ways, and that's why we come up with this total value.
So it's very difficult to do that. So I'll give you an example. We've been in Nepal for 25 years. We're working in a particular area. I can tell you that the infant mortality has gone down, the contraceptive prevalence rate has gone up, the maternity mortality rate has gone down. So we worked there. So we did a good job, right? So what would you ask? So we should get rewarded for that, right? What do you think? What else is going on there? Well, I'll tell you that the king was killed. There were 14 governments. There was a Maoist revolution. The status of women has changed, and the economy has changed. So how much did we do? Well, I can tell you, I think we did a lot, but it would take a lot to figure that out. And so the problem with all these groups is that it's very hard to judge impact in the time period that you want it to judge it, right? So it's a PhD thesis. You could disaggregate and figure out how much it is. But the problem is we're running projects all the time. So there's a difference between research and what we normally call monitoring and evaluation. Researchers hate us because what researchers want to do is have a control group and then an intervention group, and then you want to leave it alone and let it run. What we want to do is to keep monitoring it. When something changes and it doesn't work, we want to change it. And the researcher will say, I can't do it anymore. I can't judge the impact because we've just changed it. So that's always a tension with these groups between sort of management people who are running projects. We don't want to just do things that are, feel good, and we have a whole division that does monitoring and evaluation. But if you put a gun to my head and said, can you really prove it? The answer is it's really hard, number one. And number two, when you ever see where the money goes publicly, goes to Save the Children and CARE and World Vision, et cetera, and how do they get the money? They tell you stories. This starving kid, adopt this kid. Why? Because they can't give you the impact that they really have. I mean, they do good work, but it's very hard to say, I give you $50, what do I get out of it? It's the right question to ask. It's just very hard to tell legitimately. Yeah?
Have you ever looked into predictive analytics where they can take the impact that you've made now and then run it through the computer and find out where it would be 10, 15, 20 years?
You can do that, but there are other concerns about it, which is we're running programs now. We may not be running it later on, so we may give it over to the government. Will it work the same way when the government takes it over? We don't know. So there are two major issues in international development and global health. One is scalability. That is, everyone could run a pilot program and make it work. Because you over-resource it, you put in really good people, it works. When you give it out after that to the government or to some other implementing agency, it may not work because they don't have the resources to make it work the way you've made it work. So scalability is really an important one. The second one is sustainability. So JSI runs a program for 20 years, we leave, what happens? How do you judge whether it's going to be sustained by the country itself or the NGO itself? Those are the two big issues in international development always. And if you think about the evaluation framework, it's also hard to know, are you interested in getting that project to work, so I immunize those kids now? Well, we can do that, and if you judge us, we're going to do that. If you say it's sustainability, well, then we're going to train people to do the immunization when we leave. That's going to take longer, and you won't see the same impact. So these are very difficult questions. Yeah.
Business school.
Yeah.
Do you have any alliances or collaborations with large global for-profit corporations that have exceptional distribution systems? The company I'm thinking about in particular, which has won at least once the global award for best healthcare management of employees and so on, Unilever.
Mm-hmm.
And Unilever has by far the best distribution system,
Mm-hmm.
So that they're all over the world.
Yep. Yep.
And the supply chain issue you brought up in terms of partnering with them to get the products to remote areas where they already have large retail, networks.
Right.
So is that something you work with?
We do work with them. Actually, some of the delivery was done, bringing it to these countries was by UPS. I mean, so we have partners with them, but they're private sector. So if you want to sell a lot of condoms, which don't cost very much, they're not as interested in something that costs a lot more because the margins are higher. So, I mean, they're good at it. There are places, that have teamed up with Coca-Cola because Coca-Cola is every place you can go. But they're not as interested. I mean, their job is not to be public servants. Their job is to return investment for their investors. So we definitely have worked with them.
I'm just thinking because many of them at least pay a lot of lip service to social responsibility and alignment.
Lip service is the right word, yeah. Yeah. Yeah, I mean, some of them are quite good at doing that, but yeah, and we look for every way of doing it because you imagine so we have a full, are you from India?
Yes.
We have a full India office, 100% Indian run, and they use some of those kind of things. And India has this social responsibility law where they're supposed to give money. They don't always, but they're supposed to give money. All the corporations, Tata, we have money from Tata and other places. So we're not. So JSI is partly profit-making, partly non-profit. So we're not against private industry. It's just, are they interested enough in doing it? Yeah.
I've been a volunteer with International Rotary Club
Yep.
for 25 years.
Yep. Polio, huh?
Yeah, since 1987.
Yeah.
With the Polio Plus,
Yeah.
we're pretty much, we got a matching grant from the Gates Foundation for $100 million, and we're very close to doing that.
Yep.
How can we work with you? Because we're all over.
Just send us the $100 million. We'd be very happy to.
No, we got to keep some.
All right, 99.
But how can we, because we're all volunteers.
Yes, yes.
How can, because we're building homes in Mexico.
Yeah, yeah.
We're in Argentina.
Yeah.
We're in Uganda.
Yeah.
We're working with wells, building wells. So how can I go back to my Rotary Club and say, I just met you.
Yeah.
And we want to find some way to work with you on the projects that we're doing.
Yep. Yeah.
How does that work?
Well, a couple of things. One, I was on the committee to give out, Gates used to give out $1 million award to institutions that have made the most impact in public health. One of them was, and I was the chair. I tried to get it. I tried to get it to JSI. They said no. So Rotary was one of those because those of you know, polio. There's an attempt to get rid of polio. The only one. 3 countries. Yeah. It's still somewhat problematic, but so we, as you would, we work with local institutions. So Rotary is not sending people out there. They're working with local institutions, giving them that money. And so we work with those institutions themselves to upgrade them, to increase their quality, to increase their accountability. So.
But we also pick up hammers and go home.
It is, yes. So did Habitat and Humanity. Yeah, yes. Yep. Good stuff. Yeah. Back there. Yep. Yep.
Thank you very much. I have a question about patient safety.
Mm-hmm.
Any project related to patient safety and reduction of medical errors in developing countries? I'm familiar with IHI, Joint Commission, what they do here.
Yeah.
What about your work in development?
We haven't done that, but we actually have worked with IHI who work overseas as well. IHI is Institute of Health Improvement. The guy who runs that, he used to be the Medicare director, whose name is Don Berwick. He lives 2 doors down from me in Newton, Massachusetts. So, yeah. So, great group. But we also, I should say, work a lot with universities, a lot with other groups, because we have a sort of a strategy about what we're good at. But then we're not going to try to reproduce what IHI is doing because they do a good work. So we will subcontract with them. We subcontract. We work a lot with, just in terms of East Coast centric, Harvard, Johns Hopkins, University of North Carolina on doing research. One of the reasons I've come out here and.
Isn't there, I'm just saying.
Huh?
USC just isn't there.
So you didn't let me finish my sentence. One of the reasons I'm out here is to talk to Berkeley, to talk to UCLA, to talk to USC, to say that we don't want to be just East Coast centric. We want to start to draw on talent throughout the country, because we do a lot of joint programs. And as I said, it's silly for us to do research. I mean, we do research in a very operational level, but pure research, universities do that fantastically well. Why should we try to do it? We won't do it as well. We won't be as credible. And we make a working relationship with them. So we also do it with IHI and other groups. Yeah, way back there.
Can you talk about some of your first projects that you did in the very, very beginning to start your company? And then secondly, I was just curious, talk a little more about the work that you do with HIVAIDS here. And just share, that's something that's a little concerning to me. I just came back from China.
Yeah.
Went through, the airport here, and I was curious to see how I was going to be checked out. And I mean, it's basically just like filling out a bunch of forms on paper, and then having my temperature checked, and then I'm good to go.
Yeah.
It's really scary to me. It's like a third world country in terms of how we're managing healthcare data here. And I'm just curious if there are any comments about that.
Yeah, where we started in the U.S., we started in New England. The first project we ever had was a family planning training project. So there's something called Title X Family Planning, which is funding all the family planning of low-income people in the United States, always under attack. doesn't do abortion, never did abortion, couldn't do abortion, but it gets conflated with abortion because some of the people who we would subcontract with will be Planned Parenthood. So they might do abortion with someone else's money, but not with this money. And there's something now called the gag rule, which is trying to make it so Planned Parenthoods can't get any of that money. So the first one we did was a training program of all the family planning providers in New England, in the 6 states of New England. And we did that strategically. So this group is a little bit more strategic than most in the sense that there was someone doing that work. We saw what they were doing. We thought there were gaps in what they were doing, and we proposed something radically different and won it that way. On the coronavirus, we actually have a guy who is leaving Riverside today, who is on that first flight coming in because he was in Wuhan because he's from China. And his father was ill and he was in Wuhan, and then he's a dual citizen or American citizen, but he's Chinese by background. And smartly, tells you something you should do when you go to countries. You can register with the State Department. None of us ever do it, but he's smart enough to do it. So when they had a plane, he and his wife got on that plane. They were taken to Riverside and they were there for 14 days. The 14 days is up today or yesterday. And he said, and in China you can't use Google, so he had to somehow text me and tell me where he was. He said people treated him incredibly well. The CDC did a great job. The only problem was they were in a military base, and so it was very difficult for them. I think I told Sophia, they were right before, about 2 Saturdays ago, they started to get restless because they couldn't leave, and there were about 25 kids, and so they asked them what they wanted. They wanted pizza and beer and a big screen TV to watch the Super Bowl. I don't know if they got it, but that's what they're interested in. Yeah.
You talked about the change in international global development in the context of how many more people now are employed that are members of the countries that are working.
Yep.
And that's a huge change from my experience 20 years ago.
Yeah.
I'm wondering if you can talk a little more about arcs of change in John Snow's work and in the developing field like that.
Well, some of that is that we now, more of our staff are international. If you think about it, there's a management challenge to that. So we have, as I said, a very distinct culture. What do you do in Uganda? When you have 100 people in Uganda who you have to create a culture there, and you're not there all the time. So there's a very, sort of interesting ways of thinking about how to do that. So that is going to continue. The funding agencies now are much more interested in going to the local groups. Why should you go to JSI? Why can't you go directly to a local group? Theoretically, that's probably right. Probably in a practical terms, doesn't work all that well in some of these countries because the countries themselves aren't very stable. They're very political kinds of things. But that's the arc of what's happening. We have a full India subsidiary. We have a full Kenyan subsidiary run by all Kenyans, trying to figure out and anticipate which way the field is going. No one really knows because it depends on the donors doing it. So it is that arc that we're doing it.
So were you asking kind of like what got
What got us there, or what? I think.
I'm interested in other areas where those kinds of changes are apparent in the work you do.
Yeah, well, as I said, I think it's much more the localization of those. And again, let me point out that when JSI does work, and let's say immunization, we do a lot of immunization around the world, we never give out a shot. We're working with an NGO or a government to figure out which vaccines, when to buy them, how much to buy them, how to distribute them, how to evaluate what happened, how to train the staff. So that's, as I said, it's the local groups that are actually doing the immunization itself. So, yeah. Yep.
I'm a business school student.
Oh no.
Serious.
Oh no.
You've talked a culture, and I'm curious, also thinking about your career over this
Yeah.
time, how you yourself have evolved as a leader in this evolving climate.
How have I changed?
Yeah, how you
I don't change. I'm too old to change. Come on. You know, one of the reasons that JSI has been so, I think, successful, I mean, and success is relative. You know, for our field, we're successful. And because it's not a fixed structure, they get to contribute right away. So as an example, there's no longevity benefit. The guy who answers the phone gets the same benefits as I, you know, salaries are different, but he gets the same benefits I do, et cetera. So there's a sense that everyone is in it together. I also should tell you that we have sort of what you would call bimodal distribution. So we have a lot of young people right out of undergraduate school or early MPH training, very few MBAs because they make too much money. And they are supposed to stay 2 to 3 years because they do a lot of the administrative support, then they do some technical. And their learning curve goes like this, and then it goes like this. And we have no place to put them. And so the best thing we can do is to say, you should leave and go back to another place or get an advanced degree. And we tell them that the day they walk in. So, and then the second mode, no one ever leaves. I mean, they really never, we have people 30, 40 years. You know, the only reason they leave is a spouse goes in a different direction or something. So, you know, the management of this is different. And I also should say, it's very liberally managed on the programmatic side. We try things, we fail, we try them more, we invest in new ideas. On the financial side, we're as conservative as possible. This is not a high return on investment organization. So in the last year, we were audited 18 times. By the federal government, by the Commonwealth of Massachusetts, by the state of New Hampshire, by California, and I can guarantee you if you're in compliance with one of those, you're out of compliance with the other ones. And so it's the management of it is really, because of this bottom up, we have people stepping up all the time, and it's a bit entrepreneurial. So as an example, people said, well, you know, one of the big issues is in the United States is aging, which of course I relate to quite heavily now. So what do we do about that? Well, we just hired a woman to open up that kind of area for us. So where did that come from? That came from the people within JSI who said this is a big area. I'll just give you one other example, and that is about 10 years ago, there's a woman who's worked for this other organization, World Education, which is doing literacy and women's empowerment, and said, you know, there are 11 million orphans in Africa, depending on how you count them, because of HIV and because of, you know, wars and all. We have to do something about it. And said, what do you do about it? There's no orphanages that you could put people in. She said, well, you know, it's a big issue. I said, write me a business proposal. Tell me what it is. Well, we have to do health, education, psychosocial support, livelihoods. And she wrote a business proposal, not 100 pages, but, you know, maybe 25 pages of here's the rationale, here's why we should get into it, here's how much it would cost. And we invested, I think, just about $250,000, which for us is a good amount of money to build this. And she has a $25 million portfolio now. So that's how it goes. It's very bottom up. We actually had a kind of Shark Tank kind of thing. So we said to everyone, tell us good ideas, and we will commit $1 million to several good ideas that come up. And people throughout the world, maybe we had 250 proposals, and we narrowed it down, and we got 6. And we really did have a Shark Tank. You had to make a presentation. And who evaluated these was a mix. It wasn't just the senior staff. And then we picked some to do it. So it's a little bit different way of thinking about it, but partly it's because of the people who are there. They're there to make an impact. They're there to have interesting lives. They're there to work on issues that I think are important. And so that's how it works. I'm going to, yes. Yeah.
Question. I was wondering if you could expand more on this concept of JSI being non-hierarchical. Do you have practices in place to maintain that since that is like very unconventional?
Yeah, I mean, some of it.
Is it just you, or is it?
No. It's just not. Well, it started with me, and the reason it started with me. First of all, I had been, I guess, what you would call now a coder at IBM, and anytime I asked a question about someone about the hierarchy, they said, "Oh, just don't ask them. I mean, they'll never tell you the thing." And the hierarchy seemed to stop me from doing things. So I thought, well, why do you do that? So part of it is learning style. So I'm the president. So you come into my office and you say, well, it's not Joel, he's the president. And you're not going to tell me you're afraid to tell me what goes on because I'm the president. Well, maybe I'm jerky and maybe I'll fire you and maybe, who knows what happens. So I have to diffuse that because I learn interpersonally. I don't learn just by reading stuff. So when it started, it was me saying, I want to learn from all these other people and I don't want the barriers to say, he's the president. I'm not going to tell them, But then we hired people, and this is sort of a defender of the faith. They all believe this now. And so as an example, I don't have a secretary. I mean, we have 2,500 people. I don't have I do my own scheduling. I do my own Xeroxing. I write some of the proposals. I'm there at 3 in the morning writing a proposal. You can't tell me it's not your job. It's my job. It's your job. You better do it. We end every week with a wine and cheese party. I mean, we're not quite Facebook. We don't have ping pong tables, although we actually do have one in Washington, which I'm trying to get rid of. But we have bagel breakfast, all sorts of things to get people together. And it's also just the nature of who we hire to tell them that your job, you come in tomorrow, you don't have to wait 3 years to say anything. You contribute right away. So I'll give you one other example. We also always have interns. Last year we had 40 interns at JSI throughout the world. We pay every one of them because otherwise you get a kid who can afford it. We have high school students, we have international students, we have college students. And we get them to write at the end of their internship what they like. And it's actually on our website. It's very instructive. And one of them wrote, well, you can't believe, because so many of the others have internships that just say, just do this little task. And she wrote, well, you can't believe it. I just could walk into Joel's office and we spoke for 30 minutes. I mean, this was startling to her because I was the president and she was there a week or two. But for me, it was great because I learned what she was doing. I learned she was at school. I learned what they were learning. So it's that kind of modeling behavior. And one other thing, which I think I mentioned to Sophia, is people are very good at understanding what the culture is. So that's who I am. That's who the people are now. But if I said to you, just come into my office anytime, but I was fairly autocratic in how I thought, you wouldn't come into that office. So part of it is people are very clever, and you have to model the behavior that works for you. So we have competitors who are very hierarchical, and they do quite well because they find people who would find JSI, too strange. I mean, how do you, the fancy word is decentralized. The unfancy word is chaotic. It's a little crazy, but that's the buy-in. And so I always speak to a lot of student groups, and I always say to them, just find a group that, whatever it is, that speaks to who you are. I mean, everyone needs a job so you can do it, but you might as well get a job that sort of enhances who you are, as opposed to saying, I'm just going to be fighting this culture all the time. I just don't like it. And as I said, there are people who like someone telling them 15 things to do every day and go home. That will never happen at JSI, but we don't get those people. Thanks.